Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the osteology of the ulnar bone. The ulnar bone is a medial bone of the forearm. Remember in the previous video we said, or video on the radius, we said that the radius is the lateral bone of the forearm in anatomical position. Today we are saying that the ulnar is a medial bone of the forearm. This is the forearm and this is our medial bone here. If you zoom out, you have your ulnar bone. It is the medial bone of the forearm in anatomical position. It's a long bone forming the stable axis of the forearm. It forms the stable axis of the forearm, unlike the radius that moves during pronation and supination. They articulate with the humerus proximally and with the radius distally. Remember that in the video on the radius, we said that the radius articulate with the humerus proximally and as well as with the ulna. While for the ulna, it articulates with the humerus and the radius proximally, while distally, it articulates only with the radius. It's divided into a proximal end, a shaft, and a distal end. This is our proximal end, this is our shaft, and this is our distal end. The proximal end of the ulna, we have the olecranon, we have the trochlear notch, we have the coronoid process, we have the radial notch, and we have the ulnar tuberosity. The olecranon process is a large proximal projection that forms the elbow prominence. Now, take your hand and feel behind your elbow. Flex your elbow and feel behind. You see a large prominence. That is what we're referring to as the olecranon process. That's the trochlear notch, which articulates with the trochlea of the humerus. We have the coronoid process. It's an anterior projection. This is our coronoid process, an anterior projection. This is our olecranon. This is our trochlear notch. We also have the radial notch that articulates with the head of the radius. So a radial notch here. And we have the ulnar tuberosity, which is the site of insertion of the brachialis muscle. Ulnar tuberosity, site of insertion for the brachialis muscle. Now let's look at the shaft of the ulna. The cross section of the shaft of the ulna is triangular in shape. It has three borders, anterior, posterior, and an interosseous border. Remember we said that the interosseous border forms a border gives attachment to the interosseous membrane. It has three surfaces: anterior surface, posterior surface, and a medial surface. Now the distal end of the ulna. The distal end of the ulna, remember in the last video we mentioned it that the proximal end of the radius forms the head, while for the ulna is at the distal end that you have the head of the ulna. It's a rounded distal expansion. The rounded distal expansion. The head of the ulna is a rounded distal expansion. It articulates with the ulnar notch of the radius. It has a styloid process that gives attachment to ligament. This is our styloid process, and it is separated from the wrist joint by an articular disc. Remember that we said that the radius forms a joint with the scaphoid and the lunate distally, while for the ulna it does not participate in formation of the wrist joint. Please take note of that. It does not participate in the formation of the wrist joint. It is separated from the wrist joint by an articular disc. Yes. So now we move to muscle attachment of the ulnar bone. We have the brachialis muscle that attaches to the ulnar tuberosity, which is here. We have flexor digitorum profundus that attaches to the anterior and medial surfaces. The anterior and medial surfaces of the ulna. There is the flexor digitorum profundus muscle, while the pronator quadratus, that is distally, look at the distal end, we have the what? The pronator quadratus, that is here. In the extensor carpi ulnaris, that is the posterior part of the what? Of the ulna. Now looking at the ossification, we have primary ossification center, which is at the shaft around the 8th week of fetal life. We have secondary ossification centers, which are found at around the olecranon and the distal end, and fission, just like the for the radius, it occurs in late adolescence. Look at the clinical anatomy of the ulnar bone. For the clinical anatomy, we have olecranon fracture. Whenever one falls on their elbow, whenever there's an elbow trauma, there could be a fracture of the olecranon. We also have nightstick fracture, which is an isolated fracture of the shaft of the ulna and is important in elbow joint stability and forearm rotation. The ulna plays an important role in the stability of the elbow joint as well as the rotation of the forearm. So that will be all for the osteology of the ulna. Thank you for watching. Don't forget to subscribe to Alacrity Explains Anatomy and turn on your notification button so that you see whenever you get a notification whenever we drop